Hi, good evening. We appreciate everyone taking the opportunity to be here. A few of you in person and some more obviously connected virtually. So we just wanted to take an opportunity this evening just for about 60 minutes to be available to answer any questions, any concerns. You also had the opportunity, if you so chose, that you could submit questions beforehand, kind of give us an opportunity to prepare and make sure that we can adequately address your question. I'd like to start with a few thank yous and some introductions. First and foremost, I want to thank the health department, Mr. Ray and his staff, whom he'll introduce here in just a moment. But it's been a very trying time since March, and I would just like to say on behalf of the Noble Local School District, we're very fortunate to have the staff at Noble County Health Department that we have. They've been very supportive through this whole reset and restart plan to bring our kids back to school and bring our athletes back to competition. And I feel like that they've always tried to work to find solutions, not just provide barriers. And I think you'll get a chance to hear them tonight, and you'll get that same sense that I get. As of today, beginning September 8th, we do plan on providing both a return to school on a 5-day week regular schooling, traditional schooling calendar, while also providing a remote option for those folks that choose. So more details will be shared as the evening continues. As far as the Noble Local team, I want to extend a thank you. Philip Theobald is running all the technology connected. He's going to flag any questions that you may submit online while you're watching from home or wherever you may be. And we certainly appreciate Philip. Philip's done a lot of work since March, improving our remote learning capabilities and our distance learning capabilities. And our campus is not the same as it was in March to try to better serve our students and families who may or may not have adequate broadband and internet. So we really appreciate Philip's efforts. Justin Dinas, our high school principal, is here. Eric Schultes, our high school athletic director. Chad Miller, our elementary middle school principal. Mr. Milliken, our middle school elementary assistant principal. And last but not least, Lauren Thompson, who's going to be the busiest person, hopefully not, in the district. She's our school nurse, and she'll have a lot of information tonight that she'll be able to share in response to the questions that you've already submitted. The plan for the evening, I'm going to introduce Sean, let him say a few things, and then I think we're just going to start answering the questions that were submitted in advance. When we answer those, we'll answer any others that are submitted online or by folks who may have questions and feedback here in the audience. Sound good? Mr. Ray, thank you.
Hello, everyone, and thank you to Noble Local Schools for hosting this town hall meeting so that we can work together collaboratively to try and answer some of your questions. Let me do a couple introductions first. If you don't know, my name is Sean Ray. I'm the Noble County Health Commissioner, which means I'm in charge of the Noble County Health Department. With me is our Director of Nursing, Sherry Rayner, and our Director of Environmental Health, Kirby Moore. And so we'll all three, along with the school team, TAC team, as we get into some of those questions here in just a moment. I do want to make a couple of opening remarks and just kind of set the stage for why we're here. And I think you'll see some of these comments in writing later on. But first, let me state that we're experiencing right now probably the greatest health threat to Noble County in over 100 years. In fact, the 100-year mark is important to us because the Noble County Health Department itself was actually born out of the Spanish flu pandemic, which recognized that public health needed to make some changes. And so today we're now living through the COVID-19 outbreak, which is impacting the world, impacting the United States, impacting the state of Ohio, and impacting Noble County. Now, the fortunate part is, as we sit here and talk today, as of our discussion, Noble County has the lowest rates and incident rate of COVID in the whole state of Ohio. So does that mean that we stop everything and not do all the recommendations from the governor and public health? No, our goal and what we're doing here today and what we're discussing, one, today the emphasis is getting your kids back to school in a safe way to prevent the spread of COVID-19, with the ultimate goal that Noble County comes through this whole thing at the bottom of the state as a result and limits the impact on us. So the other statement I want to make is that over the last couple of months, we at the Noble County Health Department have been actively engaged with Mr. Leffingwell and all the administration here at the school as we try and work and help facilitate this safe restart to school. And it's been extremely enlightening to us. I want to say, I've publicly said this to all of them, the Noble County Health Department, our mission is not to be your educators and run this school system. In fact, it's fantastic to witness the expertise that you have here in your administration and the brainstorming that they do together through all levels of education to accomplish not only educating but doing it safely. And so our only mission here is to assist in how can we do that safely to protect your kids, to protect the staff, and protect the families that the kids are returning back to. Most of our recommendations through public health and from the federal government are basically based on 5 very solid principles that are meant to be built upon each other. The first one on the list is for you to vigilantly assess the symptoms of your children and the staff. Means let's constantly be on the lookout for all the symptoms of COVID-19 and ensure that the staff and the students don't come to school sick. The next one is active washing and sanitizing of hands to prevent the spread of COVID-19, to thoroughly clean and sanitize the school environment, to limit the spread on shared surfaces, to practice social distancing, and to implement the face coverings policy. And please understand that there's no one of these that solves the whole picture. It's meant to be stacked and put together in order for us to be effective at this time at preventing the spread of COVID-19. I think I'll end it that way. I tell you, I just can't emphasize enough how happy and proud I've been for all of us to be a part of this discussion and implementation. And I think that your school has stood up and is doing everything they can to bring your kids safely back to school and continue the education of them. And on that, I'm going to be quiet and we can go to some questions.
Yeah, before we move into the questions, I'd just like to point out that, we're in the education business, and one of the things that we have to do as adults in the education business and hopefully pass along for our students is we always want to learn and grow. And I will tell you that I had such an opportunity to learn and grow last Monday when we welcomed our staff back, because my mind was around a previous health order. So people wore their mask into the auditorium. We had seats marked and identified, so they sat and they were spaced out. And then I encouraged people to take their mask off, and truly thought that we were doing what was acceptable and a good, safe practice. Things are always changing, and I learned that that was no longer the best practice. And so we've always learned, we're making adjustments. It was not a situation where I needed to feel embarrassed or feel awkward or uncomfortable. The reality of it was I was educated. I had the opportunity to grow. I had the opportunity to learn new information and how I needed to handle that better in the future. And just know as we go through this, we're all in an unknown situation. And we're going to provide answers to these questions with the best knowledge that we have to date. But please understand, we recently put out our Back to School magazine. And in my message there, I say it's 2 weeks ago that magazine went to the printer. People are going to be getting that in their mailboxes in the next 2 or 3 days. Things have changed. Things have changed. So we're going to be very patient with one another. We're going to be patient with our students and families, and we're all going to learn together as we battle. You know, the hardest battle is something that you can't see. And then we speculate oftentimes as to what is it that we're really battling. But we're learning and we're growing, and we thank the health department for that. So we'll start off. Question number 1, what will the quarantine protocol be? Ms. Rayner?
Good evening. I get to answer this one. So I'm going to give you a simple version of what the quarantine process will look like. And then the best way to understand it is to give some examples. So I'll give some examples at the end. First of all, the health department will notify the school nurse that we know of a staff member or student here at Noble Local that has tested positive for COVID or is a probable case. And then from there, the school will be helping us do some contact tracing. So ahead of time, they're planning to provide us with seating charts in the classroom, on the bus, at lunch, at recess. So we're going to be relying on those seating charts. We're going to be relying on the teachers and tracking the movement of either that staff member that's positive or that student for 2 days prior to their symptoms starting. So we will track all their movements, and we will identify anyone that is a close contact. The definition right now of a close contact is anyone less than 6 feet from the infected person for more than 15 minutes. So if that is the case, when we go back and do those retracing of their steps and their school flow, that person would be identified then as a close contact. The health department would then contact that parent or that staff member, and they would need to quarantine for 14 days. From there, that's the simplified version of the process of quarantine. I do want to state that quarantine cannot be lifted by going and getting a test that's negative. It has to be a full 14-day period because the incubation period for COVID-19 is 2 to 14 days after you've been exposed. So we stick to that, and the only way a person can be lifted from quarantine at the conclusion of those 14 days is by the health department. A physician cannot write a note to get them out early. And if you would hear that someone in your student's class was tested positive and you didn't get a call that your child needed to quarantine, that's because they weren't identified as a close contact. And that's because of all the measures that the school has put into place to keep that distance, to wear masks. So there are lots of things happening, lots of planning that we have worked with them to implement. It's not always possible, but they are doing the best job possible to keep those kids at that 6-foot distance. And if they need to be less than 6 foot, it's going to be a less than 15-minute interaction. So it's very possible that a student in a classroom may only have a couple students that sit exactly near them to be quarantined. It's not going to be an automatic situation of if there's a positive student in a classroom, that entire classroom is in quarantine. Our job, our number one responsibility for the health department is community health and safety, and that includes our schools and our students. So we will take that job very seriously. If a person needs quarantine, we will definitely be contacting them and asking them to do that. However, at the same time, we understand the constraints the school's under and trying to keep distancing with students and so forth. And I believe this can happen and they can do it. But the way things are set up, we will possibly only have to quarantine a couple of people in a classroom, not the entire classroom. So if you're not contacted by the health department, you weren't a close contact. And I guess that's really about it on that one.
Yeah, one of the things we even discussed today, if you're, for example, a middle schooler and you're in this pod or group of students, you're with that group for the day. And though you might go to 4 classes a day, it's likely that my seating chart will be the same in each classroom. So the fact is, I'm not going to sit in close proximity with Joe, Fred, and Sam in this period and then go over here and be with Susie, Shirley, and Linda. And I thought that was a great idea that Mr. Miller and his staff had today, because that's going to further limit that close contact group. Second question, Sherry, if you would, if one sibling tests positive and his or her class is quarantined, will other siblings in another grade be quarantined as well?
The answer to that is no. So if a student is identified as a close contact to an infected person, someone who is positive or probable for COVID-19, their sibling in another grade will not be quarantined. If that student that's quarantined that had the close contact with the infected person, if they become sick and then test positive, then of course their siblings are close contacts. So siblings would be included in a quarantine process at that time because they're family members. But no, so it is possible that there could be multiple family members attending school. One of them could be quarantined and none of the rest, depending on where their close contact was.
Very good. So question number 3, I think Sean and I can address this one fairly quickly. What would cause the school to close again? How many cases? Is there a certain number of cases? Are there a certain number of students that would need to be out before we close? So every school district has a crisis plan, and every school district has a policy that's fairly the same. I will also tell you they were developed without any thought of COVID-19. So the policy itself says when 50% or more are out of school. That does not mean that we have to wait for 50%. That was a guideline. So as we learn, I would tell you that's going to really be a case-by-case basis with good communication between us. But Sean, I'll let you add to that.
No, I think that was the exact vague answer that I wanted to give. In every instance of closing the school due to an illness, it should always be a conversation between the health commissioner and the school superintendent. Either one of us has the ability to close that school because of a health issue. We shouldn't be doing that in a vacuum, and I know that we won't be. In fact, there was another school district that closed due to illness last year that in reality, the reason wasn't the percentage of students. It ended up being because of the percentage of the staff that was also ill, and they couldn't keep the school properly manned. So there's a lot that goes into that. And the final point, because I think that I want to make that ties into Sherry's discussion on quarantine and this discussion of ours on closing, is the fact that if we get to that point of that discussion, the whole school administration and the Noble County Health Department and the people who are feeding their kids to the school, we've all failed. The plans that are being implemented by this school district can succeed with proper support, and we should never get to the point that we're discussing having to close the school. And in fact, if we have more than 5 to 10 people quarantined due to one case, we have failed again. They have put in appropriate measures to try and limit the number of people a student has contact with. So our effort is to be surgical and only remove the kids from the school that absolutely need to be. It's not our effort. We don't want 100 people in quarantine. That is just the wrong answer. So, thank you.
The fourth question that was submitted: how will one nurse be handling all illnesses? If she sends a child home with COVID symptoms and is possibly exposed and then is passing out meds to the other kids, that seems to me like the potential for community spread. So how will this be handled? Laura?
Thank you. Hello, everybody. So when a student presents to the clinic with COVID-like symptoms, the nurse, which is myself, will don full PPE to provide close contact care. So with this, it includes a face shield, mask, gown, and gloves. That's considered full PPE or personal protective equipment. Isolation precautions will be followed. The clinic will operate on an appointment basis to decrease multiple students arriving at the same time, and that way it'll also allow for proper precautions to be followed in between. So we currently have separate areas for students who will be coming in for illnesses and possible quarantine, and also those coming for medications, checks, blood sugar checks, things like that. And these are available both at the elementary and at the high school. At this time, we do have a plan to have another nurse to assist me. So that will help, and she can kind of take over some of the medication part while I'm taking care of the ill students. But in the event that I am the only nurse in there that day to take care of that, I will follow isolation precautions, like I said, and don PPE, remove properly, wash in between, and place new protective equipment on to care for another student. So I won't be caring for an ill student and then crossing over to care for another student while I'd be contaminated. So also with that, I would ask the parents speak with their children about necessary nurse visits. So we aren't loading down clinic visits that wouldn't be needed. So just because it will take more time in between students and patients to take care of them. Thank you.
Stay here. Don't run off. Question number 5. If a child or staff is sent home with COVID symptoms, do they have to be tested and produce a negative test to return to school?
Okay, so not every student or staff member that is sent home will have to be tested. The current signs and symptoms that we are looking at in regards to COVID are fever and chills, cough, congestion, fatigue, muscle and body aches, diarrhea, headache, sore throat, shortness of breath or difficulty breathing, nausea or vomiting, or recent loss of smell or taste. Along with assessing these symptoms, we will also look at that person's close contact or potential exposure. So that would be if they have had individual has had close contact with a confirmed COVID-19 case within the last 14 days. They have traveled to an area reporting large numbers of COVID-19, or they have been instructed by a public health or medical professional to self-monitor, self-isolate, or self-quarantine in the past 14 days. So based on the findings that the student or staff member may be sent home, they may just be asked to stay home until they are symptom-free for 24 hours, and that would be without the use of fever-reducing medicines, or they will be referred to be evaluated by a healthcare provider, and at that time, that provider would determine if testing is necessary. So if an individual does test positive, like Sherry had said earlier, the health department will determine when that person can return to school, and they will have to provide us with that documentation that they're allowed to come back into the building.
Mr. Ray, I think this is a question for you. Will Noble County have a testing site available to test for COVID other than trying to get in to just a few of the doctor's offices?
I think as long as we're at the current low incidence rate, probably not. But the thing, if you haven't learned with COVID, is that every day and week and month things change. If we have a need to request extra testing within the community, we have access to that, but we have not had that request. I will say that the other part is that there are other sites available. It's just that those are the two that was in the question. Dr. Spencer's office, with the assistance of Jake Biedenball, his nurse practitioner, can do the testing within their office, and Amy Welsh, nurse practitioner at her office, can do it in. So those are the two that the testing occurs within the office, but also available to many of the residents. Ohio Hills, in their Barnesville location, will test anyone. Southeastern Med, at their location up on Clark Street, can test anyone. Genesis has a quick clinic up in Zanesville, and Marietta Memorial has a clinic also. There's multiple sites down in Marietta. So at this point, we have not had a further need for more testing than that. The majority of the physician and hospital situations still require a diagnosis from a physician or possible diagnosis from a physician in orders before they do the testing. So the other part I will put in around testing is that, again, it's evolving. So there are new tests being developed and come out on the market. Some of them we're not ready to embrace yet because they have too high of a false positive rate. Other ones we don't just know about so quite yet. So I think we're going to see rapid tests become available sometime in the future, but they're not here yet. We'll also see a change in testing this fall as we get closer into the flu and cold season. There's efforts about to have a testing where you can actually test for COVID, influenza A and B, RSV. I think I'm missing one other, but so there will be a couple of multiple test scenarios as well, because we are also slowly learning that you can be co-infected with more than one. So.
Thank you. We had about 20 questions submitted in advance. I'm going to try to go through the next few myself and try to answer the best of my ability, but they're fairly cut and dry. The question number 7, what will the grab-and-go lunches and breakfast consist of? Is this a hot lunch or brown bag field trip type lunch option? And our lunch menu will be very consistent with what it's been in the past. The nutrition group's done a fantastic job, so it just won't be a cold cut sandwich. It'll be the typical hot lunch. And just remind everybody, you can download the app, NutriSlice app or NutriSlice.com, and you can always access the school menu either through that app and website or our school website as well. So it's going to be a typical breakfast and lunch, much like that we've traditionally served. So there's no significant changes in regards to what type of lunch or breakfast is being served. The next question, question number 8, what is the arrival and dismissal going to look like? Will all students unload and load buses as usual? Pretty much. You know, if you're going to ride school transportation, you're going to board the bus with a mask. You're going to wear that mask at all times. You're also going to have assigned seats on buses, which is not unusual. So folks know typically our drivers have assigned students to assigned seats. So again, it goes back to that contact tracing. We want to be able to put kids in the safest place possible on those buses, as we always have, and we want those seat assignments to remain consistent. We want masks to be worn. The unloading procedure, we're going to try to space those out somewhat, but pretty much we're going to go get on buses and we're going to get off buses as traditional, because we understand during that time it's going to be less than 15 minutes. So the duration of time that we're doing that, and there's a question down the road about lockers. We're going to lockers. We're using lockers. And I'm going to address that one while we're on this topic, because the reality of it is no one's going to their locker for 15 minutes. It's a common area. It's a large area. It's a common area class change situation. Everybody will be masked. We won't be there for 15 minutes. And quite frankly, the dangers of having everybody's stuff piled in different places is far greater than contracting the virus under those circumstances. So that's our policy and how we're going to handle bus arrival dismissal in the locker situation. So question number 9 was actually who's going to enforce the social distancing while at lockers, bathrooms, etc. We're going to try to teach our kids personal responsibility, the reasons we wear masks, and we've learned a lot. I will tell you, our original policy, as I told you before, we learned a great lesson earlier this week, because we were actually operating as we thought that we should be, but we were using old information. So our original thought to open school was you had to wear a mask at any time that social distancing wasn't possible. And now we know to add that multiple layers of protection, we really need both, or we would like to have both. But there will be mask breaks. There's going to be an opportunity a kid can get out of that mask and take that mask off. We're also aware through the policy there are some exemptions, and we're going to talk a little bit more about that tomorrow with our staff and what that looks like and how that's documented. But I will tell you this. We provided our families a choice. That choice is, we hope you come back face to face. We think that's best for kids. You know, we think, and I think we discovered last spring, the best place to get an education is here at school, here with your peers, here with our staff. But we did provide a remote option. If you're someone that wants to come to school and not follow the health and safety guidelines, then you're choosing remote. You're choosing remote. Not a suspension. You're not suspended from school. If you don't want to follow the guidelines, then you'll be assigned to remote learning. Because obviously that's what you really want if you're not able to come and follow the safety guidelines here. We want you to have respect for one another. And if you choose not to follow those rules, then basically you're saying, I'm more important than helping take care of you. And so in that case, I would suggest that family or that student is choosing the remote option. Obviously, there could be a discussion prior to that. It wouldn't be one strike and you're out. We're in the education business. But after a reasonable number of attempts, we would just think maybe this is not the option for you. But we believe we've created a situation that's very, very safe. I feel very good that districts across the state are following many of the things that we're doing with our schedule and how we're grouping kids and how we're moving kids. And I would tell you, I feel very comfortable. I would feel very comfortable sending my son or daughter here and feel like that the face-to-face is certainly the best option. Question number 10, I'm going to allow our principals to speak a little bit on this one. But what is online learning going to look like exactly? Will students be expected to be logged in the entire length of the school day? And how will their work be turned into teachers? So while they're coming up, let me just say this. Last spring is not remote learning. Last spring was our best attempt, given little to no notice, to educate our kids who are no longer allowed to be in our building. One of the things that I've kind of charged our staff with, we talk about having the choice. You can choose remote or you can choose face-to-face. What a lot of people don't realize, even choosing face-to-face, I have to prepare you on a moment's notice to become remote. Because if we do have a child in that quarantine situation, or quite frankly, a student with a typical illness, why should they go uneducated for a 10-day period when they can log on with the device that we provide from home? So we really think this could be a game changer, not just because of the virus, but at any point in time. If you have to travel to Columbus and you don't have childcare and you're forced to take your fourth grader with you for that day, but they have some internet access and they have their device, why would we not allow them to participate and connect with their classroom virtually? So the answer is, the ideal remote situation is that child will connect during their class schedule to the greatest extent possible. If that's not possible because of childcare issues, etc., then we will have a recorded option that you can access that later when you get home, possibly that evening, mom and dad get home from work. Again, I think the face-to-face option is preferred, but this is definitely going to look a lot different. The other thing that you need to understand, this is a game changer as far as attendance goes. If something happens, maybe I have a few symptoms, and mom and dad choose it, hey, it's best to keep you home today, just for precaution. But you don't have to miss school. You can still connect. You still have that access, and guess what? And you're counted present at school. So it is a game changer. If there's a silver lining of COVID for educators, it's the fact that we're finally being forced out of our comfort zones to embrace the technology that, quite frankly, we need to prepare our kids with anyway. So I think it's been a positive conversation. Justin, Chad, you want
to go back to the question, we do expect kids to log in and be in live with their classmates. And does that mean that that's going to be for that entire block? Because we're going with a odd and even schedule, so they'll have 4 periods a day. Does that mean they'll be there 90 minutes? Not necessarily. It's kind of going to be at the teacher's discretion, but they can still log in. We've been working to where the teacher can put them in group work virtually this way. So they may do all kinds of different things, but they will be, online and working. There's 7 hours, basically the school day, in and out all day long. That is our expectations, and it does change the attendance factor. It changes the attendance factor for a teacher. Should they get quarantined, they may be able to log in and teach class from home. They just can't necessarily come here. So it is a game changer, but we do expect you to be logged in and live and prompt to each of those classes. We do wonder and worry a little bit about some of these classes, like welding's going to be a challenge. We're going to have to work at some of these options and some of these classes to, there's a lot of hands-on things up here that we got to be aware of too. So that's a whole nother discussion to take into consideration, but we do expect you to be live with your teacher.
Just to add to that, again, like Dan and Justin said, it's preferred to be live. You're going to be able to interact with your teacher if they have questions. There is a recorded option if you're choosing to be remote. You can have a recorded lesson that you listen to in the evening or when it's convenient or something like that. However, it's going to be harder to connect with that teacher. What we learned in the spring was there was no shutdown time, and teachers were connecting. They were connecting all day long. Well, now we're coming back in person, and that's a concern for our teachers, a concern for me, because there was no off time for us, and that was fine. But the best way is to connect live, do the recorded lesson if you have to. Like Justin said, we don't have welding to worry about, but we do have some hands-on lessons in our STEM classes and some different classes. And we're trying to develop some kits that could potentially go home when that kid's in that elective or something. So, but it'll be a case-by-case basis. So, but that's our plans.
So one of the things that we learned, and Justin just reminded me, one of the things that we learned this spring was inconsistency was a killer in regards to communication. So we're working to develop some open house, virtual open house, face-to-face open house options where our families can come in for a period of time, sit with that teacher, and actually learn how we're going to connect. We're going to connect and communicate through two primary sources. One's a new app and website feature that we're rolling out this year called School Messenger. And then the other thing is all lessons were going to be delivered online or available online through the Google Classroom option and the Google Meeting option. And what happened last year, you get a family that had 2 or 3 children at 2 or 3 different grade levels, and you might have had to interface with 6, 7, 8, 9 different platforms. And it was really confusing. And when people become frustrated, they disengage. So we're trying to make that process very simple. But understand one thing, I want to thank our teachers. I want you to think about the last 2 questions and just what you've heard, and imagine how that changes how we work daily. And understand that we're providing a 5-day option where many of our neighboring districts are not offering that option. They're not offering that option because they're dealing with remote learners through a third party. They're not engaging them, and they're not really considering that face-to-face learner that has to transition to remote. We're ahead of the game. We're ahead of the game, but that also requires game-changing efforts. And you're going to have to bear with us as we work through some of those things. But I have no doubt that we'll be able to accept that challenge. Will the restart plan stand, and students 2nd grade and under will not be required to wear masks? Everything has changed since that question was submitted. That was the rule that even I operated on and found out that I was outdated. So right now, K through 12, unless exempted, are required to wear masks. Preschool is a little different world in that order too. So the mask requirement is required for all students K through 12 unless exempted otherwise. If masks are required by all students, are they really expected to wear them the entire day? No, not really. We have some options. We discussed yesterday through a tabletop, and again, I can't say enough about the support that we've received because we were, in our original policy, we were going to use face shields as an alternative to masks. And that seemed like a great option. I can see your face, I can see your lips, I can see what you're saying, especially for some of our youngest learners. That doesn't mean the face shield is obsolete and can't be used at all. We still plan to use face shields at times where it's appropriate. And we're looking at that. What if I have a face shield and I also have a plexiglass barrier? Well, that's certainly better than nothing at all. And if we can add that with, I'm working with you in that environment for less than 15 minutes, that's the ideal situation. So we've kind of worked collectively with the health department, and I think we have a lot of our bases covered. But there will be breaks. There will be opportunities to get outside when the weather permits. There's going to be scheduled breaks that classroom teacher is permitted to, get those kids away from each other. Let's take a mask break. So we don't expect them to wear them without taking them off. Obviously, lunch and breakfast time while they're seated, that's certainly a time that you can be out of the mask as well. Are students still going to be able to participate in their specials, gym, music, library, etc.? Chad, do you want to start with that one?
Yes, we still have, like at the middle school, elementary, and mainly the middle school, we put out a course catalog, and we've had to back off on that a little bit because we want to keep our kids in cohorts, but they're still going to go to electives. They're going to have those choices, but they're going to travel with the same group of kids all day long. And again, some things will be more appropriate for a face shield, but when we can, it's going to be a mask. That's what's recommended. So, and we're working on our sanitation of how we go through, and we'll clean and sanitize periodically throughout the day. We're going to have extra staffing to help with that. So we will still be able to share some materials. Obviously, there are some materials that we can't clean like that. So I know we just met with a couple teachers this afternoon. What extra things do you need so we can distribute additional materials? So we're working through those things, but yes, they'll attend specials.
While you're there, you're going to talk about what's the playground world look like, Chad? What's that?
Playground's fantastic. If you haven't been out there, we have this new fancy playground that is, I'm telling you, if you haven't seen it yet, you could put it in any community in the United States and they would be proud of it. It is fantastic. When kids go out, again, the recommendation is a mask. But as a 6, 7 year, 5-year-old, some of our 5-year-olds, they're going to go outside and that mask is probably not going to stay on. So what I want to recommend to our teachers is, when they're out running around, that mask is probably going to come off at different times. We've got lanyards that the mask are going to go on. The main focus when we're outside for mask is if I see a group of kids that sit down over here and they're playing on the blacktop and they're together and they're face to face in close contact, and it looks like they're camped out there, we need to require them to have a mask. But again, that running around, that's going to be my biggest fear is we start losing masks. And we get done with kindergarten recess, and I got to go find out who these 15 masks belong to. So that's how we're going to do it. And again, that could change. That could change next week, but that's right now what we're doing.
So when grade levels go out at a time, one grade level will have the whole playground.
Yep.
And they won't intermix those pods. And I think the point is, that sounds like a great time, but once I do that, then I've just really jeopardized all the safeguards that we put into place by keeping kids in groups, keeping seating charts consistent. So it may be that Miss Smith's section of first grade is on the back portion and they rotate those areas, but we're not going to mix the entire grade level together after keeping them in groups throughout the day. We're at 16. This is probably one for Kirby. I think Kirby would be appropriate, but I've been reading that the government has a COVID 2020 bill stating that if my child or child in his class or her class becomes ill, then you're required to take the students to an unknown place for quarantine and the parents don't have contact with them. Is this true? If your answer is anything but no, don't say it.
No. The answer to that is no. And there are websites that may not follow the science of COVID and have an idea of what may be going on, or there are sites that provide misinformation, believe it or not. So we recommend CDC, coronavirus.ohio.gov are the sites that we look at, the sites that we use. There are other sites that have information, but it's like anything we do. We provide science and education behind the information that comes out. Your child will be taken care of like it was most of the folks that are taking care of your children and have children, like it was their child. There's not going to be hiding anything. There's not going to be taking anybody away. They've put in provisions actually not to provide any scare to the child for anything that might happen. So no, there is not any chance that your child will be taken away and not be seen by you for 2 weeks.
Thank you.
You're welcome.
I'll ask the principals to come back up, and we have some traditional events that happen at this time of year. We have open house. We have, days to drop off our school supplies. We have freshman orientation. Chad, you want to start just talking about what that open house is going to look like, or the back to school bash might look like?
Well, obviously, we're not bringing everybody in for a back-to-school bash and having the building flooded. What teachers are beginning to do, we finalized our class list, and I'm going to touch on a class list question too. But teachers are going to be reaching out to families and scheduling almost like a parent-teacher conference. Give you an opportunity to come in, pick up a Chromebook. Also, if you took a Chromebook home last year, we're going to collect that one and give you a different one. Be able to drop off supplies, and your teacher, your child's homeroom, if you're a middle school student, your homeroom teacher will be contacting you and scheduling that time, and they'll go over how to access Google if you need that information. Make sure we have relevant contact information for you. And so you'll still get some face-to-face time with your teacher, your child, especially with the anxiety sometimes from going to 4th to 5th grade and stepping through those double doors and going to the middle school and those kinds of things. They'll be able to see where they're going. And so that's how we're going to handle that. And so you should, within the next few days, be contacted to come in next week sometime.
One of the things that I think is really going to turn out to be a great thing, we actually learned through our non-traditional graduation. When we brought graduates and their families in for a 5 or 6 minute period, even though that was a short period of time, that was a very personal experience. And it really provided some great closure to that school year, school career. So we're kind of thinking of a similar concept where, mom, dad, or whomever the caregiver may be, and the child to come in and then have that teacher have the opportunity. Here's how we're going to connect in a remote scenario. Here's a little bit about Google Classroom, or how I'm going to communicate and provide you with updated information. So I think that's really a lesson that we learned from graduation is really going to steer how we bring people back to school. Justin, you want to talk about freshman orientation or anything else you have?
Yeah, just a couple of dates since we got the forum to do so. The 26th from 1 to 3, we're going to have a in-person remote student orientation probably here in this room, because we can distance ourselves out to allow you to become familiar with the platform and all the ways that you need to log into Google Classroom and those things. So anyone that chose remote, you'll be here on the 26th from 1 to 3. And then Mrs. Warner and Mrs. Marshall sent out invitations for freshman orientation on the 27th and 28th. And we're going to spread you guys out pretty thin throughout the day from 8 to 3. You should have that in the mail already at this time. So freshman orientation is taken care of, and we're ready to go.
The one thing I would add while the principals are here, how we group kids and how we limit movement is it cannot be the same K through 12. K through 4 is going to look a certain way. 5-8 looks a little bit different. And quite frankly, we can't do that at all at the high school. So the one thing that we've done at the high school, rather than a kid having 8 periods a day, they're only going to move 4 times. That's not quite as safe as it would be in a 4th grade classroom where they're with those same 20 kids. But if you think about the courses at the high school, they're oftentimes not grade level specific. There's many classes that could have freshmen and seniors. Other than maybe your general math requirement or English requirement, you have it's just a lot of impossibility. So there's one of those examples where we had to make some modifications. At the same time, we know about the good safety procedures and protocols that Mr. Ray addressed with masking and different things. We know that limiting movement during the day is certainly better than not, but don't think that high school can look like middle school that could look like primary, because there are just some innate differences. So principals and their staffs have worked really hard to try to create the best situation. possible. So I'm going to turn to the healthcare providers and experts. Sean and Sherry both, I think you've got the next couple. Here's the question. In the event that my child's cohort is quarantined, my child is not ill in this scenario, will the health department recommend that they stay home and not go to a sitter until the child in the cohort receives a test or is cleared by a physician? Will our child have to be tested or cleared by a physician if the child in the cohort has a positive case? Will the recommendation be that the entire household stay home, or will their families default to their company policies in regards to COVID-19? It goes on. I'll just read the whole scenario. I work in healthcare and I would not be required by my company to stay home. And since my company is more than 500 employees, I don't qualify for the Emergency Paid Sick Leave Act or the Emergency Family Medical Leave Expansion Act. Therefore, I and probably many other parents would not receive adequate monetary assistance if I'm required to stay home every time that a child in the cohort is or might be sick. I'm worried that needing 10 to 14 days off work every time someone in my child's cohort is sick may result in job loss.
Okay, I think the school staff have already addressed somewhat that the plans and measures that they have in place to not have to quarantine an entire cohort. So with those plans executed properly, hopefully there would not be a whole cohort of 20 kids to be quarantined at one time. It may be one child, it may be 5, but our goal is to help the school stay open. The measures they have in place are going to, if enacted properly, are going to allow that to happen. And so quarantining, yes, and the recommendation for quarantine is you stay home. That's the whole purpose in quarantine, so we're not spreading the virus. But the goal of the health department is to help the school stay open. So we are going to do our jobs, keep everybody safe, and we're going to quarantine only those persons that are necessary to be quarantined. So if they are not a close contact, they will not be quarantined. Yes, they will be asked to stay home because that's part of the protocol for quarantining. There is no test or physician that child that is in quarantine, they will not have to be tested, and they will not have to have a release from a physician to return. That they are released from quarantine by the health department only. If they become ill during their quarantine period, that changes things. They may need to be tested at that time or see their primary care doctor and make that decision as to whether a test is needed. A test Lauren spoke to, a test will not be needed to return to school if a person is quarantined. And no, the answer to the entire family being quarantined in that particular scenario, no, that will not need to happen. Only the child that has close contact with that positive case will be asked to quarantine. Of course, they can't stay alone, so somebody will have to be home with them. But the entire family would not have to quarantine because they are considered contacts of a contact. So at that time, they would not have to quarantine. Again, if that child becomes sick that is that close contact, the family would then become in a quarantine status, but only if the child that is the close contact becomes ill.
I think I wanted to build upon her medical answer here a little bit and put a little bit of emphasis on things, because we know also that there's some suggestions out there that whatever you do, don't allow your child to be tested, and don't tell the health department anything about who you're in contact with, so that all of them don't get in some kind of trouble. And so the part that I want to say is the effort is not to get anybody in trouble. And our whole emphasis around the safe return to school and their cohorting and all the measures they're implementing and the way that we're working again, is to limit the number of kids who may possibly be exposed to someone who happened to become ill and have COVID, okay? And so that's actually extremely why the contact tracing information and your cooperation on sharing who your kid may be in contact with is so important. Because otherwise, without cooperation, then it becomes more of an expansion, and we may have to, because there's not enough sharing of information, we may have to assume that there's even more kids in contact, and that group becomes more expanded. Again, our efforts, we want to be surgical in our efforts to identify contacts and limit the number of people that we're asking to stay home throughout this process. So it's taking care of each other as we go through this process, and we don't have any hidden agenda behind anything else. So,
Excellent. Well, that concludes the pre-submitted questions. Anybody here have any questions, any follow-up? Philip, do we have any submitted at all online? Any follow-up? Yes, ma'am. Yeah, it's a great question. And one that we discussed yesterday at length, because it's kind of confusing. I can have a volleyball season and my kids can play volleyball, but the rules are a little bit different when we play volleyball in gym class. And I thought that Mr. Ray's answer yesterday was spot on. The politics of those two things are completely different. So initially, I'm going to tell you it's going to look like a classroom. The difference is we have a whole lot more opportunity in that larger space to have an extended mask break. We are talking to our phys ed teachers about what games should we continue to play versus which ones we shouldn't because of the close contact. So we are very aware of that. And we also, and the health department was very good about this yesterday too, we do understand there are times that there are risks greater by keeping the mask on. But we know that when we encounter a situation like that, then we also have to make sure that we can increase the distancing. So my best answer is, it's a great question. We're aware of it, and we're going to deal with it. I'm not going to throw people in a big mob with their mask on and work them into a froth. I mean, we're going to, really just want to focus not only on the game plan, but also during that time, just some exercise opportunities where I can spread out, similar to how things used to be. But I don't expect to put kids in a competitive situation, make them wear a mask, and risk them overheating. Does that help? I get it. I'm overheating right now. I get it. Any other questions? I think that while we still have people connected online and we have a board meeting starting, I'll say a few things and I'll turn it back over to Sean to close. One of the things that I want to make sure that people understand, we're all learning. We're all doing things that, quite frankly, we've never had to do before, we've never thought about doing before. It's not all bad. We're discovering some silver linings that I think will help us be a better educational service provider in the future. If you see something that you don't like or you don't think that's right, ask us. We're just regular people. We're having a hard time, and we're privy to lots of information. We're having a hard time keeping up with the amount of information that comes out, and it's tough.
With that being said, how will we continue to communicate with the public?
Yeah, I think we can communicate as often as we need to. We try to do a lot through social media. I think our new messaging system is going to allow us to do some things. I will tell you in regards to communication, as things change, we're going to continue. The best thing that we found out for immediate communications are all call system. And we have upgraded that. We look forward to rolling that out. Quite transparent, I think I might be the least trained person on it right now at this point in time. So we're going to get up to speed before school starts so that that's more efficient than it's ever been before. That actually allows a system in one message. If I use my phone and voice record it, it'll turn it to text. It'll post it to all of our social media. Or if I type something, it'll convert it to voice and send it out. It's going to be truly a one-stop shop. So we will try to all get up to speed as soon as possible. Yeah.
I have an online question for you. It says you spoke about items provided by the school. Can we get a list so we can prepare what to purchase ourselves, masks, lanyards, etc.?
Okay, we do have a face shield for every student and a cloth washable mask for each student that will be given out. And we'll make sure that those are available, that when especially our elementary students come in for their open house appointment, that those things can be distributed at that time. We're going to leave the shields at school. Those will stay in the classroom because one, they're hard to carry. Two, they melt if you leave them in the car. But I think school supply list, Chad, any?
We'll get those posted and just double check those. And but really, that's the main thing. I guess, we're providing one mask, and, I can't imagine wearing the same mask for 5 days straight, going to recess and everything. I'd at least, I'd maybe look at a couple more of those. These gaiters a lot of our kids seem to like these a lot better. So that's another option for you.
Good question. Yes, ma'am.
Do you have extra for the kids that aren't able to get others?
Yeah, we can likely help. I mean, right now, I think we ordered 1,200. They're very hard to get in bulk quantities like that. So right now we have 1,200. I can't honestly say right now that I can give every kid 2 or every kid 3. I can tell you I can give every kid 1. Some kids won't want them because they have their own, which is going to increase our initial supply. But we're really having some issues still with a lot of those things back ordered. But we're going to try to provide every opportunity. Maybe we, instead of having to bring 4 containers of Clorox wipes in that nobody can get, I want to talk about that. We do have material on hand for classroom desks, tabletop sanitization. And that's going to be a nice thing for us. We do have hand washing, hand sanitizing stations, not only in our common areas, but every classroom. So we're going to try to establish a new set of habits for our kids. And that's going to be part of our discussion, is about teaching our kids personal responsibility and those 5 areas that Sean touched on at the beginning. And we think those will be good habits, not only now, but when we get through the COVID and go on to live our lives. So back to the learning part, we're not going to be perfect. Our kids aren't, the adults aren't. We're going to make mistakes. I mean, we're going to make mistakes. We're going to learn. And we've learned a lot since Monday. Yesterday's activity was great. Tomorrow, the health department's coming out and they're meeting with our entire staff with just a Q&A so we can get on the same page. But we are literally learning every day. And we're going to be better a month into school than we are the first day when we arrive at school. And I would suggest this is a big challenge, but this is a big part of learning today. Respect the process of learning. Bring it to our attention. If something doesn't look quite the way you think that it is, there's a good chance it's probably not supposed to look like that. Point it out to us. Point it out. We don't need to be attacked. We need to address it. We need to talk about what was your thinking behind it. We need to know, and we need to encourage our kids, you're not always going to be perfect, but we're going to learn from that mistake and we're going to grow as a result of it. I don't think there's any better time than to teach our kids that, because COVID has forced us to deal in continuous uncertainty. We so much desire things to be black and white, and it's forced us to live in an ever-changing gray world. And we can either repel that or we can embrace that. We're going to choose to embrace it, because what we hear here through our employer groups, that's the type of people that our employers are looking for. People that can adapt, change, alter, pivot, change directions. we're really going to try to embrace that and try to teach those things as skills, because that's very similar to what many of our employers tell us they needed in employees prior to us having to deal with COVID. So adults, kids, we're going to make mistakes. Let's communicate. Let's bring those things to attention, and then we'll try to work together to find a solution. So I appreciate everybody tuning in. I'm going to turn it over to Sean or anybody else who would like to wrap up. Thank you. Great questions.
I think he wants to wrap up. So, let me just say thank you once again. And I think the thank you comes from the efforts of the whole community from sometime in March all the way through today, towards the end of August already. We've all sacrificed and changed our lives tremendously. It's paid off. Once again, I'll say we have the lowest number of cases of COVID in the state of Ohio. Absolutely. Thank you. And so that does not mean it doesn't exist. That means we're doing something right, and we've got to keep up our efforts. And our efforts tonight, in the last week or so at the health department and your administration, has been to work on the effort to bring kids back to school and educate, because that's the future of our community. Okay, and that's what it's all about. We just want to do it safely. I think one last little myth that I remembered I hadn't shared so far yet is that, everybody is saying that, your young kids don't suffer the effects of COVID. Okay, and primarily we have seen that throughout the course of the world. Okay, we do have kids getting severely ill, but as a majority and statistically they are not. But guess what? They do get the disease. And the term we use is they are actually kind of like the petri dish that we then spread around. Because we have to also realize to educate your kids, we need adults, teachers, staff, bus drivers, all of them have a lot higher health risk for COVID than your actual student. And then your student comes home and you as a parent or a grandparent have even more risk, okay? And so it's an effort to educate your children and allow that to continue, but so we keep the whole community safe. And that's really what it's all about. And for us to figure out how to do that in this new existence that we're under for quite some time. So again, thank you to everyone. And I really appreciate working with the team here. So thank you.